Thank you for joining us today, this morning, this afternoon. This meeting is also now being streamed live on Facebook. Just some very brief comments to make this function better for everyone. Please, for those people doing the presentations, try to speak slowly. You know that we have interpretation, simultaneous interpretation happening at the same time, at this time. So to make their work easier, it's important to try to speak slowly. You can find the interpretation button at the top, at the bottom to the right of your screen. Whenever somebody is speaking in a language you don't understand, you can click there and then click on the channel of your preference to hear the required interpretation. Voy a explicar esto en español ahora. Bueno, bienvenidas a todos y a todas y gracias por sumarse hoy a este webinar en el que venimos trabajando hace ya 2 meses. Queremos explicar algunas cuestiones importantes de interpretación. Cuando se encuentren escuchando las presentaciones en inglés, que son la gran mayoría de las presentaciones, pueden utilizar el botón que se encuentra abajo y a la derecha, que dice Interpretation o Interpretación, y ahí cliquear en el canal de español y van a recibir la interpretación simultánea de lo que se está diciendo en inglés en su propio idioma. De igual manera, quienes presenten en español, Carlos, Angie, Viviana, si alguien de Paraguay presenta, pueden hablar sin problema en español porque va a haber interpretación simultánea en inglés. Bien, habiendo dicho eso, yo voy a continuar hablando en inglés, con lo cual los invito a que si requieren, ya hagan utilización del botón de interpretación y puedan escuchar la traducción simultánea. So now that I'm back to English, welcome everyone once again. We are providing 1 more minute for people to arrive to the room. Some other comments I might have to highlight. I've been provided a little note with this. So please speak lowly. Please mute your microphone if you're not speaking to avoid interference. Please turn on your camera when speaking so that we make it a little bit more personal, and then we can turn it off or on as you wish. And you can raise your hand in the chat and we will try to keep track by reading the chat. And also when you open up the chat, no, here, I think that in reactions, right? You can raise up, oh no. Where is the button for raising up your hand? I can find it here. Wait, I have some more messages. Okay, so please feel free to comment whatever you need in the chat. Also, there are French and Spanish interpreters here. So if you have any specific questions that you need to make in those languages, you can do so. And now we'll be officially starting. So I'm gonna share my screen now. Well, thank you everyone for joining. We are here on behalf of the youth constituency of the CSO Partnership for Development Effectiveness in order to share some results that and some studies that we've been conducting in different regions and in different countries regarding what have been the impacts of the COVID-19 pandemic in general in our regions, in our specific territories, but also more concretely, what have been the impacts of effective development cooperation or of development cooperation in terms of youth and youth organizations. So what does this mean? Well, many of you probably here attending this webinar work in a youth organization in your own territories, and you've probably been impacted in your day-to-day work and dynamics by the COVID-19 pandemic. So what we tried to do through the studies we've been conducting was to grasp a little bit better what have been that reality for youth organizations on the ground and for youth in general. Many of you probably have already have an idea, or I mean your own personal experience of what this has implied, of what this has meant for each one of us in terms of civic freedoms and our freedoms of expression and also of assembly and gathering. So by conducting these studies, we tried to grasp a little bit better this reality and turn it into more concrete numbers and figures, and something that could be worked on, also thinking of advocacy and, well, basically what's related to the CPDE or CSO partnership agenda, which is to advocate for more effective development cooperation. I'm going to make two comments before handing in the floor to our first presentation. The first comment I would like to make is the fact that we conducted an open call to all of our members to see who was interested in conducting this research, and we had very good feedback. So that's also why you will be presented with so many cases today. Each region decided on their own methodological approach for conducting this research. So that's also interesting. Not all regions conducted the research in the same way. We had a common guide, common themes we wanted to focus on. This was agreed at the partnership level. And then each region decided, well, we're going to conduct interviews. We're going to do them face-to-face. We're going to do them, well, face-to-face was a little bit more hard, but we're going to do them by phone. We're going to do them by email. It's going to be more personal, less personal. We're just going to base ourselves on secondary sources. This was something that was agreed and decided upon internally for each region. So I think that's also going to generate different results in the outcomes of the studies, which will be interesting to look at. And one more thing I would like to mention is the fact that we are just about to be able to share with everyone a guideline we've been working on for the past year on effective development cooperation for youth organizations. If you are unfamiliar or not very well familiarized with what effective development cooperation is and what it implies for youth organizations, then you'll be able to find out more about it by checking out this guide. And we're hoping to have it translated into Spanish and French as well. So by saying that, I'm going to hand in the floor to Rita from CamioSoft. She's going to be presenting the case study by Cameroon. So Rita, floor is yours. You want to share your own screen, or do you want me to share the screen for you? Hi, Rita. Oh, you're muted.
Yeah, I'm trying to share my own screen. Can you see it? Can you see it now?
Yeah, I can see that.
Awesome.
Okay. Good afternoon, everyone. My name is Suwun Rita Berry. I am the Programs Officer of CamioSoft and the Youth Constituency Regional Coordinator for Africa. And I'm happy like six countries participated in the data gathering process, including Botswana, Cameroon, Tanzania, Comoros, Zimbabwe, and Namibia. And these case studies are going to be presented today. So without wasting time, I'm going to go straight to the study that was conducted by the Cameroon Youth and Students Forum for Peace, CAMYOSFOP. And this organization is based in Cameroon. And I just want to say that Cameroon is found in the in Central Africa, the western part of Central Africa. So CAMYOSFOP is an NGO that was created in 1999, and we were legalized by the government in 2001. And our mission is to promote youth voices in development processes. And one of our main programs is developing policy papers on youth issues. And these policy papers are used for advocacy at different levels. And you can see on the screen that I highlighted some of these policy papers that we have published since 2010 till date. So about this study, like Josephina mentioned, there was a call that was made and organizations expressed their interest. And the main objective of the study is to assess the impact of COVID-19 on youth activism, employment, and growth in Cameroon upon appraising the Bosan principles. That's how we caption our own studies, so that nothing is left out, so that we also get the impact of the COVID response measures that were put in place on young people. And it had five key parts: socioeconomic impact, ownership, inclusive partnerships, human rights at the core of the pandemic response, CSO's good practices in leveraging EDC in COVID-19 response. And talking about the impact, the socioeconomic impact. No, let me first of all talk about the respondents, the category of respondents that we targeted. We targeted the students, youth CSOs, young people who work in the informal sector, young civil servants, and private sector workers. Just to mention that all these were young people. And we collected data from both primary and secondary sources. We used the SPSS to analyze the data collected. And the final report was compiled in English. And we moved straight to the socioeconomic impact. And the first thing we did was we tried to get the measure that was implemented in Cameroon to curb the spread of the virus. And from the survey, we gathered that Cameroon came up with there was a partial lockdown that was implemented in Cameroon. And schools were shut down. Businesses were allowed to operate from morning to certain hours in the afternoon. And people were encouraged to only go out when it is necessary. So from the charts, you can see that 86% confirmed that Cameroon imposed a partial lockdown. And because of this partial lockdown, people were faced with different problems. It affected people differently. For young people, there was a shortage of goods, led to mass unemployment, salary cut, and a vast increase in the number of dependents. Also, it led to job loss and an increase in the prices of commodities. And from our survey, we gathered that due to all this, most young people were not able to afford basic commodities due to the increase in the prices. And based on the fact that the face mask was compulsory, the wearing of a face mask was compulsory, and these were being sold, the fall in income made it impossible for some people to afford the mask because of the prices. As you can see from the chart, those who accepted that it led to an increase in the prices of basic commodities, 80% of the respondents. And then those whose jobs were affected, we had 80%. So with all this impact that the partial lockdown had on young people, we wanted to know the type of assistance they received from the government. And surprisingly, 70% of young people said they did not receive assistance from the government. And just 13% acknowledged that they received support from the government. And they mentioned that this support came in the form of face masks, hand sanitizers, and other COVID-19 protective kits. People were expecting, we were expecting to see there was a reduction of taxes or those in the informal sector, or that the government tried to regulate the prices of basic commodities in the market, but this did not happen. So moving to ownership, we wanted to know whether there was a national response strategy that was put in place in Cameroon. We were also trying to assess if there was a formal CSO consultation and if young people participated in these consultations. Yes, there was a national response strategy that was put in place in Cameroon, and the government also prepared a response plan that was over $600 million with a health response strategy under the leadership of the Ministry of Health, which has 8 components. All these components are outlined in the full report, which we are going to share after this. But the problem here was youth CSOs never participated in the elaboration of the national response strategy. As you can see from the chart, very few CSOs participated, if at all there was any. I don't know the people who said they participated, because from our survey, most young people did not know the composition of the COVID response committee that was put in place. And no one knows whether CSOs were part of it or they were not part of it. So the problem here is, I don't know whether the information about this was not put in the right channels where youth can regularly, where young people regularly work, or it was not published at all. Because everybody knows there was a committee, there was a national response strategy, a committee was put in place, but no one can tell you the composition of that committee. And then we also looked at inclusive partnerships. We assess youth engagement, the design, implementation, and monitoring of the national strategies, and then the national legal framework to ensure that CSOs have domestic resources to respond to the COVID-19 pandemic. And we also wanted to have examples of government CSO partnership on COVID-19 response. Under here, the respondents still mentioned that they were not consulted in the development, in the design, implementation, and monitoring of the national strategy. And the legal and regulatory framework did not make it possible for young CSOs, for youth CSOs to have access to domestic resources to respond to the pandemic. And this can clearly see, this can be justified, because when we asked about the examples of CSO government partnerships in the COVID-19 response, we had very few. Moving now to human rights, at least the measures implemented by the government affected fundamental human rights. You see 62% of the respondents mentioned that it really affected some fundamental human rights. Like, for example, in Cameroon, the schools were shut down and many people were not able to have access to health. And also there was freedom of assembly, freedom of was an attack on the freedom of assembly and freedom of association, because people were not allowed to go out anytime, and some meetings were dissolved as a means to curb the spread of the virus. Due to the fact that schools were shut down, the government took measures to ensure access to education for all through online studies, and this was done through TV stations and radio stations. But the problem here is not everybody had access to this because they didn't have the gadgets to follow the lessons online. And those who were privileged to have it are those like in those in elite schools, mostly in urban areas. So those in the rural areas, children in the rural areas were left behind. And also the government of Cameroon tried to provide access to health, ensure that there was access to health for all by providing free treatment to COVID-19 infected persons. But even at that, the majority of the people are left behind because the social security system does not permit. It covers just a very minor population, and mostly those who work in the public service. So majority of young people who work in the informal sector are still left behind. And lastly, we also look at CSO's good practices in leveraging EDC in COVID-19 responses. And we discovered, we were trying to see if youth organizations had a COVID-19 response strategy. And from our survey, we discovered that many of them have. And they try to implement the guidelines from WHO and also implement activities in the field to mitigate the impact of COVID-19. And I'm happy most of the organizations, or the few that I know, we are working in the rural areas. And I would like to share the example like Camiosfop. Camiosfop was, we targeted the indigenous people, and those are the people that are further left behind, distributing COVID-19 protective kits and sensitization. So from the data gathering, there were some recommendations, some key recommendations. I will just highlight the key recommendations. Most respondents recommended that policymakers should ensure targeted physical transfers are provided to informal sector workers during such emergencies. I take the case of Cameroon, for example, we have bike riders, private schools, and taxi drivers. For private schools, due to the lockdown, the shutdown, teachers in the private sector, we are not able to have a salary.
Rita?
Yes.
Hi, sorry. I'm going to have to jump in because we need to move on to the next presentation. I know this is the last slide, but this has already taken a little bit too long. But thank you very much. It was super clear, very clear. So I'll leave everyone with that key recommendations for action slide, and I'll give the floor to our friends from NAYO.
Thank you.
Thank you, Rita. Sorry about cutting, but there's need for time.
No, it's okay, I understand.
So where?
All right, thank you. So maybe can you share the screen from that side?
Yes, I'll share it from my side. Give me 1 second. Here. Where I'm not in the right slide. Wait. Can you see my screen now?
Yes, I can.
Perfect. So we're gonna have to pick it up a little bit on the pace for presentation because we have so many cases. So just you let me know.
All right, it's fine. So thank you so much, colleagues. My name is Diana Harawa, and I'm from the National Association of Youth Organizations present in Zimbabwe. So we are also part of the research. So on my presentation, this is just the overview of the presentation where we look at the framework of data collection, the demographics and coverage, the 5 themes that we're focusing on the research, and the views from the consultation meetings, then lastly, the recommendations. All right, so from my first slide, the tools that we use to collect data, we send out the questionnaires, but given that sometimes young people, they are not too formal, you send out a questionnaire, they don't fill every section. Sometimes if it's an open-ended question, they'll just highlight yes or no. So we end up doing Zoom sector-specific meetings to say 15 young people with disability, 20 students, youth CSO, so that we could have a deep understanding on the issues that are affecting them during this COVID-19 pandemic. And also of specific, we did interviews with the Zimbabwe Youth Council. It is a quasi-government institution, which is a bridge between young people and the government. And it was the one which was responsible for administering the COVID-19 Youth Relief Fund, an assistance that the government come up with, and also the Vendors Initiative for Social and Economic Transformation. This is an youth civil society organization which works with young people in the informal sector. You know, in Zimbabwe, 85 to 90% are in the informal sector. So we wanted to understand more on the challenges. So that was mainly on the data collection, and we focus on young people. All right. We focus on the generally young people, youth civil society, the students, youth with disabilities, those in the informal sector, and youth in civil service, teachers and nurses. Thank you. All right, so coming to the social economic impacts. So for the last presenter, she presented on issues to do with face mask. But in Zimbabwe, the president announced to say that even if you put a face cloth or a doek on your mouth, it's a mask. So there wasn't a challenge in terms of the cost on mask for young people. So on this slide, Zimbabwe implemented the COVID-19 response mechanism in 4 phases. So the 4th phase, we had a total national lockdown, and then we moved to phase 3 and phase 2, which was a partial lockdown, and with the ongoing restriction on movement. So in the level 4, it was total shutdown. Level 3, they introduced a curfew 6 to 6. Now we are in the level 2, the curfew, it's it's from 6 in the morning to 8 p.m. So there's still restrictions on movement, although they've relaxed on intercity travels, but still movement is still limited. So when the government introduced the lockdown restriction, prices of basic commodities, they rose beyond the reach of many people. And according to a survey by the Ministry of Industry and Commerce, the value of the consumer basket, yes, at 7 February 2020, was at 4,656, but by 11 April 2020, the same amounted to 6,660,084 cents. So prices of basic commodities, they rose beyond the reach of many people. But later on, through the multi-stakeholder consultation between the government and the private sector, prices were reduced. And on the 21st of April, through a statutory instrument, prices were reverted back to the normal pricing. So looking at the other socio-economic impacts, students were heavily affected by the increase of data bundles. Education continued, but they were using their online platforms, but due to data increase, many young people were left behind. And according to an assessment by student unions, a mere 15% of the entire students' population have access to Wi-Fi and data. So it means most of young people were left behind. And an option that they were using was to use their WhatsApp groups to get information from their lecturers and also updates from the schools. Then those young people in the informal sector, they were also the hardest hit by government response to the COVID-19 pandemic. Their vending stores were demolished, leaving them with no means to resume. And also, even up to now, with the relaxation of the COVID-19, the sector remains closed for those in the informal sector. Also, young people who are into community-based volunteers, their work were also affected. Youth CSOs were closed. On the total lockdown, all those sectors, especially those who do with democracy, human rights issues, they are not regarded as essential workers unless you are an organization and you do programming around social service sector, education, food, water and sanitation. Those are the ones who are allowed to operate. Otherwise, all the CSOs are closed up until now. So we can go to the next slide.
Just one more small comment. We need to try to go through the slides a little bit faster. So maybe just bringing out the main ideas, and then we can share the presentations with everyone, with anyone that wants the presentation. Okay?
All right, it's fine, thank you. So on the government assistance to young people, the president announced a COVID-19 relief fund of 18.4 billion, which was going to benefit all the sectors which were affected by COVID-19. And part of that money, 500 million, was towards the SME sector, those who work within the informal sector, and they were supposed to benefit 200 Zimbabwean dollar per each beneficiary. Also, young people, they were given, the Ministry of Youth was allocated 17 million youth relief fund. And so far, the first bunch of beneficiaries are the ones which, the information is the one which is in the public, and it shows that only 1,159 youth benefited from out of the 5,000 youth applicants. And from that whole package which the government announced, there was no specific youth relief fund for young people with disability. So they had to benefit from the social welfare package through the Ministry of Public Service and Social Welfare. And each beneficiary was supposed to get 180 Zimbabwean dollar. And they said they just received the the allowance in April only. So in terms of ownership, from the research that we carried out, most young people, they were not even aware of the response plan which was announced by government. So in March 2020, the government launched the Zimbabwe Preparedness and Response Plan for COVID-19 response for the period March to May 2020, to which the majority of the young people were not aware of. And in terms of their participation, through engagement with the Zimbabwe Youth Council, they said the participation of young people were limited due to the COVID-19 restrictions. So we limited participation to only Zoom meetings. We didn't do public consultation from the 10 provinces, and other young people, they said they were not even aware of that wall visual meetings that were done by the Ministry of Youth. So due to exclusion of the youth CSOs in policy, strategy, and intervention, so mainly it doesn't speak to the views, aspiration, and the position of youth organization. So however, the Ministry of Youth, through the Zimbabwe Youth Council, where most of the youth CSOs and association partner with, they are also working around the COVID-19 response through dissemination of information, through production of hand sanitizers and face masks.
Okay, we're gonna move on to human rights, and then I'm gonna have to move on to the next presenter because we won't have time for everyone if not. Sorry about doing this, but it's the only way.
All right, it's fine, no problem. So on the human rights issue, Zimbabwe is not an exceptional among autocratic states that have used COVID-19 as a tool to suppress citizens' rights and freedoms. So in our constitution, section 86, it provides for the limitation of freedoms and rights when we are responding to public emergencies. And it's clear to say section 4, which is a Bill of Rights, which provides for the freedoms of movement, freedoms of association. These are not absolute rights, so they don't apply when we are responding to the COVID-19. But what we have seen is that the government has gone beyond to restrict some of the freedoms and rights. And we've noted that through the Gazetted Public Health COVID-19 Regulation of 2020, Section 14, it speaks to say that if one communicates or publishes false information, they're going to be sentenced to a period of over 20 years in jail. So these were some of the statutory instruments that the government came up with to restrict on freedoms and rights, on expression. And also we have seen that the soldiers and the police, they were deployed by the president to monitor citizens' compliance with the COVID-19 regulation. And with this, it comes with a lot of human rights violation, the extrajudicial killings, crackdown mainly on youth CSOs and also human rights defenders and activists. So as a country, there was a planned demonstration on the 31st of July. And through that, we have seen that over 60 protesters from all over the 10 provinces of Zimbabwe, they were arrested. And till now, although they are out, they're out on bail, so they're still reporting to the police, to the High Court. And overall, on the participation of young people in decision-making during the COVID-19, the Parliamentary Portfolio Committee, if they have a public consultation, it could be on the budget, it could be on the Constitutional Amendment Bill, they're still doing Zoom meetings which young people can participate, and also utilizing the radio as a channel to ensure that all young people and the generality of the citizens participates. Thank you.
Thank you so much. There's so much information that has been gathered. but we really need to pick it up on the pace. So thank you for the presentation. I think that we highlighted some main points. Ronald, I'm gonna give you the floor now, and I'm gonna open up your presentation.
All right.
You can see it now, right?
Thank you.
Oh, you're coming in a little bit.
Okay, yeah, thank you very much, Joe, for the opportunity. And my name is Ronald Tateta. Okay, can you hear me? Can you hear me, Joe?
Yeah, the audio
Hello,
is
am
not.
I audible?
Yeah, the audio is not very good. We can
All right,
hear you.
can you hear me now?
Now it's a little bit better. Yes. Go ahead.
It's a little bit better. No, that's fine. So thank you very much for the thank you very much for the opportunity. My name is Ronald Tatenda Magome, and I'm with the Southern Africa Youth Forum, which is the regional platform for youth and youth organizations that are working across the SADC, 16 SADC member states. And we were also interested in part of this research. So I've been asked to present the research findings on behalf of the Southern Africa Youth Forum as the first representative of SADC within the African Union Youth Front on COVID-19. So this is just a high-level policy framework that has been put in place by the African Union, to allow young people to co-lead Africa's response to the coronavirus pandemic. So I'll also jump straight into, the findings that Southern Africa Youth Forum also, gathered after, engaging in this particular research in 4 countries, mainly Botswana, Namibia, Comoros, as well as Tanzania. So as much as the first presenters have also been sharing their own findings, I would also like to, confirm that, the findings from these 4 countries that SADC also carried out the research are not necessarily divorced from what the earlier presenters were also mentioning. Issues around the impacts of this, socio-economic impacts of the coronavirus have similarly been, have actually been similar to what young people, for example, in Botswana, in Tanzania, in Comoros, as well as in Namibia, were also sharing. Why? Because the COVID-19 pandemic has actually left more young people without jobs, livelihoods have been destroyed. And apart from that, young people have not been able to, to go about their, day-to-day businesses as a result of the, of the travel restrictions and the partial lockdowns that, their own national governments have also put in place. So I think we may also proceed to the following slides. Okay, so so in terms of this COVID-19 research that we also carried out, we also found out that especially on the element of human rights, Tanzania had much of respondents who actually noted that there was a little bit of shrinking of civic and political space within Tanzania itself, and some of them were actually also noting that in of the COVID-19, this was also done through the use of a partial lockdown that the government also instituted. And as part of that, restrictions in terms of movement and travel were also put in place. But however, the impacts of all these to young people were actually huge, because most young people were not able to go about their day-to-day businesses, worrisome from this way. Also how, especially the government then ended up closing the civic and democratic spaces, especially for young, the freedoms of expression and assembly, where the government have also been noted to be violating, especially the rights of journalists, among others. And we've also noted, especially how the international community has also been raising the red flag to Tanzania over the shrinking of the political and democratic space. The respondents also asked to human rights, and they also further noted that the violations were around, the freedoms of expression, as well as, as assembly. You may also proceed.
Namibia and Botswana?
Okay, so okay, yeah. So in terms of Namibia and Botswana, I would also like to share, that the responses that we got from this particular research, we did not really get much from, these young people from Botswana and Namibia. But however, the issues that the respondents, most of them also raised, were actually, similar issues. For example, we had students from both Botswana and Namibia who were actually sharing that, the closure of schools actually affected how, their education continued to go as a result of especially the online learning, where most of the young people did not have the data bundles as well as, the assistive devices, especially those with disabilities, to enable them to enjoy, online learning as the schools have been closed. And in Namibia, there was also an interesting element where, the involvement and inclusion of young people. The government have also tried through the National Youth Council of Namibia to involve, young people, where young people have been trained, by the National Youth Council of Namibia, and after their trainings, they have also been, deployed to the various communities to share, awareness around the COVID-19 prevention, as well as the wearing of masks, among others. Then, in terms of recommendations now, where we are specifically looking at Botswana and Botswana and Namibia, the need for governments to ensure, total support and investment towards the youth, especially during pandemics. This was also noted. Then also the need for governments to invest in healthcare financing was also strongly recommended, by the young people, because we have also noted that most of our SADC member states, our healthcare systems are deteriorating as a result of huge levels of corruption, among others. Then also the need for governments to engage in multi-stakeholder consultations that are inclusive, to respond to disasters, and also that involve the participation and meaningful engagement of young people were also part of the recommendations that the respondents also shared. We may also proceed. And I think most of all these have also been captured, intensively in the research report that we have also, submitted. So I think now the slides are beginning from the first, from the start, and especially also on Comoros, what the respondents that we also engaged on shared with us was that, in as much as the Comoros government also put in place measures to contain the spread of the COVID-19, the rise and hike in terms of the basic commodity prices also affected a lot of young people, because most of them also survived on the informal economy, and the restrictions in terms of movement also meant that their businesses were going to be closed. Hence, most of them ended up reducing their own salaries. Most of them were not able to meet the expenses of their own businesses. And some of them were also noting that, they were not able to buy the basic commodities due to the high levels, high prices that, resulted after the government instituted, the partial lockdown, as well as the restrictions in terms of movement. But after everything, has been said, what we have also noted from this research is that not many young people were actually aware, especially of the how the national, COVID-19 response teams within their own countries have been constituted, because most of the young people were actually noting that they were not, involved in terms of the governments coming up of the COVID-19 response strategies. And some of them also noted that the inclusion of young people that was only done were just tokenistic, where young people were just been, engaged to distribute sanitizers, to, run around with buckets of water to allow citizens to wash their hands, among other issues. But the meaningful engagement and involvement of young people at the policy formulation level, especially of the strategies to respond to the COVID-19, young people in Botswana, in Namibia, as well as Comoros, also felt that, a lot has not been done in terms of engaging young people, because we also understand that young people are the major, chunk of the populations of these countries that we are also talking about, and hence their meaningful engagement and involvement, remains very, very important. So on the socioeconomic, impacts, most of the respondents, Comoros, yes, Joe, yes.
Yeah, I'll jump in there, and I'll
Okay.
move ahead to the next presentation. But thank you so much for also bringing in this aspect on youth tokenism. We'll go back to that on the questions later. Thank you very much for this very complete research, diverse research.
Thank you very much,
Jenson, I'm gonna be handing in the floor to you now. And we're moving on to the research and the studies conducted in Asia.
Yeah, thank you so much, Joe.
You'll share your own screen?
Yeah, sure. Yeah, sure. Where is it now?
Or I can share it for you also.
Is it, I think my screen is on, right, Joe?
Yes, perfect.
Okay, thank you and good evening, everyone. Yeah, this is me, Janison, and for better just audibility, like I would like to just off my video. Yeah, this research was participated by 3 countries, Pakistan, Afghanistan, and India, mostly from the northeastern part of the India. So I will not go much detail into who all took part in it, but we will try to reflect that in the harmonizations of the all the data which was gathered by our team from the Asia. To start with the socioeconomic impact of COVID-19 in the country, we could see that nationwide lockdown by imposing CRPC 144 and close down of transportations, hospital, government and private institutions at the initial stage, but which later on it was revised, and who will be who are in need to be open was actually highlighted, was announced. As per the Ministry of Statistics and Program Implementations informed that during the financial year of 2020 and 2021, there was a sharp fall of the GDP by minus 23.9%. However, many of the financial experts revealed that it was 33% sharp fall on the GDP as compared with the 2019 and 2020 GDP, which marked at the 5.2%. In the research report, we got information from the secondary data as well as from the interview, and also from the from the questionnaire which was replied, which many of the organizations and individuals responded. In that, we came to know that 75 million MSME in India and close to 25%. This firm faced closure, where 40 to 50% of their regular income has been hit by the COVID-19 lockdown. In this, during the lockdown, 40% youth were affected by the COVID-19, and out of the 84,404 by the time of receiving the report, we got that 7% of the youth were mostly affected. 41 lakhs youth lost their job, as per the ILO and the ADB Asian Development Bank report revealed that 41 lakhs youth were unemployed. Yeah, denial and negligence from the treatment of non-COVID patient by the COVID and by the government and private hospital, lack of accessibility to medical facilities due to the lockdown. The non-COVID patients were denied for the treatment by many of the hospitals in the country, which are also reflected in many of the media reports and the civil society organizations, but failed to be reported by the government agencies. Summary and description on official ODA. India received $1 billion from the World Bank, $1.5 billion as loan from ADB, 750 million USD from AIIB, and the BRICS and other sources from the Japanese government were received, but accurate amount has never been made public by the government. With regard to the ownership, Government of India imposed nation lockdown as a plan to respond to the curve COVID-19. Distribution of viable informations on the Ministry of Health and Ministry of Health official website. Launching of Arogya Setu applications to trace and know where this COVID-19 is being hit in many of the area, and so as the citizen can take the precaution on which are the area being hit, so that they can make aware of themselves and not to be vulnerable with it. So informal COVID-19 task force was formed by the Prime Minister as a chairperson of National Disasters Management Authority. Distribution of ration rice to every citizen free of cost till the month of November, in which many of the people failed to receive it. No parliamentary session was conducted both in upper house and the lower house. Instead, cabinet meetings, state executive meetings were executed from time to time. CSOs communicate with the government to make available of basic communities and other daily essentials, etc. And on the other hand, non-governmental funded organizations provides awareness to the community, distributes relief materials, donates PPE for the frontliners, financial support to the vulnerable groups who are the daily wage earners, and many others, develop reports and submit it to the government for better response. However, no positive response could be observed. Inclusive partnership. As per the survey conducted by the Indian Institute of Management, Ahmedabad, it could be learned that CSO, civil society leaders, did not find mechanisms to work with the government effectively, as also not very receptive of the input provided by the CSOs. Youth CSOs could not get access to any relevant government information except for the information of the status or number of positive people, recovered people, and death, and SOP to be followed by the people to prevent the COVID-19 infection. With regard to the result of the consultation with the CSOs, the government, no such outcome could be observed till date. It was mandatory for CSOs to obtain permissions from the concerned district commissioners to work accordingly. CSOs and other NGOs were appealed by the government to identify COVID-19 hotspots and to deliver service to vulnerable groups. However, the CSOs and NGOs are not invited to be part of the task force being established by the government. As CSOs are not in part of the task force or bodies, but CSOs and NGOs provide inputs and suggestions to the government. However, no positive response could be observed. CSOs still continue to provide relief support to vulnerable sections. CSOs or activists are booked and arrested for providing suggestions to the government, which further violates the fundamental rights such as freedom of expressions and laid down under the Constitution of India. During the lockdown process, without the consultation of the people, we could see that Environment Impact Assessment Amendment Bill was introduced by the central government of India, favoring the corporates, introduced various policies allowing the corporates to conduct mining activities such as coal, oil, and other minerals without the consent of the people. Amendment of the FCRA, Foreign Contribution Regulation Law, was passed during the lockdown, which restricts and hampers the work of the CSOs in the country. Transparency and accountability. There are grievances and redress mechanisms for the government of India, as a central helpline and the state helpline were open. However, no participations of the CSOs in such mechanisms could be observed, neither they were invited. As such, the CSOs' positions are not reflected. Instead, they are charged upon for criticizing the government. In most of the cases, the data are not made easily available to the public. For instance, the citizens are restricted to obtain information through even after filing the Right to Information Act applications to the government. One vivid example is that in the Indian Parliament, when asked by the oppositions on how many migrant workers died during the lockdown, the government replied that no such records are available. This is a clear sign of lack of transparency and accountability in the country. Focus on results. The government has a results-based framework in COVID-19 response. However, due to ill management and administration, the virus could not be contained as per the plan objectives. Therefore, the result-based framework could be observed as less effective. Leave no one behind. The Prime Minister of India declared a COVID-19 relief package wherein 200 trillion, that means USD 260 billion, in which the ODA is not mentioned specifically and conditionality imposed for the loan and others are not yet met public till then. The improvised and marginalized sectors, groups, gender issues, women and children issues are not prioritized in the process. With regard to the human rights issue, there is increase in human rights violations committed by the state during the pandemic. For example, we have our own example that our president and the secretary of our organizations were arrested for giving suggestions to the government on what would be the better solution in order to go ahead with to curb the process of the COVID-19 crisis. There are no specific information provided on amount of loans and grants, and no such informations are made public till then. Good practice, this is the last slide. Good practice of the CSOs in leveraging EDC principles in COVID-19. CSOs implement the COVID-19 response through the guidelines provided by the World Health Organizations, communicate with the national and state human rights organizations, human rights commissions to direct the central and the state government to strictly respect the human rights while containing the virus. The CSOs adopt the right-based approach during the process of advocacy, having the objective to stop illegal arrests of human rights defenders, to ensure equal distribution of essential commodities during the crisis, and to ensure basic necessities of living at the grassroots level. As a strategy, we, the civil society, communicate with the government to ensure and address the aforementioned issues so as to curb the spread of COVID-19. The rationale is if the people are starving, then it's a human nature to search, to earn and secure food to feed their children and their family members. Some of the civil societies working at the grassroots level encourages the community people to restore vegetable plantations and paddy cultivations, which was stopped for almost a decade after the mandatory distribution of food grains under the National Food Security Act and public distribution system in every household. CSOs, in consultation with the community people, brainstorm the youth who have returned from the metropolitan cities, losing their jobs due to lockdown, that the indigenous peoples cannot be separated from the ancestral land and it is a need to be protected for the future livelihood. Further encourages them to work and earn utilizing the resources found at the villages. The remaining recommendations will be reflecting in the after the process of the harmonization. Thank you.
Thank you, Jenison, so much. Such a concrete and strong report. And I'm also taking notes, and I think it's interesting to note this movement of youth going back to their lands, right, to their villages. So I'm going to give the word now to our friends from Scholarship for Afghanistan. I think who's going to be making the presentation? Somebody new. Hi, yes.
Hi.
Hi. Are you able to make your own slide sharing, or do you want me to share the slides?
You can share the slides.
Okay.
Yeah.
1 second. Once again, to keep the time, let's try to move as quickly as possible through it. Go ahead.
Well, thank you. Hello, everyone. Can you hear me?
Yes, perfectly.
Okay, thank you. Hello, everyone. I am Muhammad Asif Asil from Scholarship for Afghanistan. Good evening. I'm speaking from Kabul, Afghanistan. And I want to present the findings of the survey conducted by Scholarship for Afghanistan to discover or understand the application of EDC principles, national strategies and policies in response to the COVID-19 pandemic. Our survey covered the topics such as socioeconomic impacts of the COVID-19 pandemic, the impacts that the COVID-19 socially and economically brought to the people's lives, for example, loss of job loss and people going under the poverty line, and also students living out of schools. These were the social and economic impacts of the pandemic, as well as the pandemic economically impacted our businesses in the country. These are regarding socioeconomic impacts and ownership. The ownership of response or fight against the pandemic mainly relates to the Afghan government, which according to our respondents, it's almost 80%. Then inclusive partnerships. We had an inclusive partnership in response to the pandemic, and there were different stakeholders in response to the pandemic, which they were working. The first one, the very highest percentage goes to the government, which was the mainly responsible body, and specifically the Ministry of Public Health of Afghanistan managed this. And human rights at the core of the pandemic response. Also, human rights, there were some violations of human rights and some problems, especially regarding women, but in general, it was good. Human rights were also observed, but there were some cases of violations and also limitations for women to access the health services, and also some sort of violence were increasing against women during the lockdown. And finally, CSO, good practices and leveraging EDC in COVID-19 response. Civil society organizations in Afghanistan contributed somehow well to the fight against the pandemic. For example, they contributed to launching awareness campaigns, and also providing credible information to the people, and also providing aid or relief packages to the local communities to combat the pandemic. So these are the patterns or the examples of the CSO good practices.
Thank you. So
the next, the strategies. The strategies the Afghan government implemented to mitigate the impact of the COVID-19 pandemic were lockdown. For example, the government imposed lockdown in major cities, not a nationwide lockdown, but in the capital and also some major cities like Kabul, Herat, and Mazar-e-Sharif, our cities, and restriction on movements. This was another strategy that the government implemented. But these two strategies also led some impacts on the people's lives in terms of economy and also in terms of social condition, like job loss, like the increase in poverty rate. And the next strategy was the government implemented a social awareness. The government launched some awareness raising campaigns, and also the government supported the media channels or outlets to provide information to the people, and also cooperated with the other media organizations in the country to raise people's awareness, which it had good results. And the last one is funding. The government launched some funding schemes or programs for the people, like launching bread distribution programs, and also providing relief packages to the people in each corner of the country. So in general, these four strategies were implemented by the government to combat or to bring the pandemic under control.
Great. So I'm gonna jump ahead to because you have here who you surveyed.
Yeah, with the survey participants.
I'm gonna have to jump ahead a little bit, if you don't mind, just to the impact on small businesses. I think you mentioned something on this, and I'll move ahead to other impacts.
It would be better to talk about the stakeholders, I think. Just a little bit ahead. Responding bodies to the pandemic in Afghanistan. So there were these 5 stakeholders or 5 categories were involved in response to the pandemic. The government, civil society organizations, volunteers, these private sectors and international organizations. So the main body or main responding body responsible in the fight against the virus or in the response was government, according to our respondents. The next, civil society, although civil society did some very great jobs in response, but there were some limitations for the civil society as well, that because it was the civil society organizations were not mainly involved in policy making, and the ground was not provided somehow, but CSOs contributed very well to the response. And also international organizations. Our government invited multiple international organizations to help and support the government and the community to respond more effectively. Now to the impact on business. The impact in business in individuals. The impact on individuals is in 4 categories. First, the poverty rise, which is almost 60%, and job infection is 22%, and job loss is 20%, and the last one is family or relative losses, which were created for the people. So regarding the impact of pandemic on business, the pandemic impacted businesses in Afghanistan, large and medium-sized businesses or small businesses in 4 parts: business closures, and decrease in demand and sales for the businesses, lack of employees, and as well as increase in price of goods. These were 4 categories the business were impacted by the COVID-19 outbreak. The next slide is other impacts. Most importantly, lack of access to education. It was one of the major or one of the significant impacts caused by the pandemic. School closure, university closure for some months. It was one of the major impacts, lack of a fair access to education. Besides this, psychological effects or stress of the pandemic were reported by our respondents. And finally, violence, especially against women, which they were not given access or their rights were violated, especially during the lockdown. So these were all impacts of the pandemic on the people. The next slide is the lessons we learned as a result of our survey. We actually found out some points which I have highlighted here. The first one is awareness.
Que supone esta crisis, que ha sido la organización, que ha permitido que las organizaciones se fortalezcan más y que puedan también generar otro tipo de estrategias frente a la pandemia. Como lo mencionaba, en este momento no solamente estamos viviendo el ataque pues, de la pandemia del COVID, sino que también la represión del Estado, precisamente porque las organizaciones se han movilizado en posición a la inconformidad que se están viviendo. Uno de los grandes desafíos o retos es que las instituciones puedan generar esa alianza de construcción colectiva que hasta el momento no ha sido pues efectiva. Entonces se plantea que si las instituciones pudieran brindar esos espacios de participación, seguramente la respuesta frente a la COVID pues sería otra. Frente a las lecciones aprendidas en el territorio, pues es fundamental explicar que la juventud en este momento ha sido muy importante, que la vitalidad y la creatividad de las juventudes para llegar a territorios ha sido a partir de que nos hacemos propios, de que nos sentimos dentro de esa necesidad y que también tenemos presente que muchas personas están pasando hambre. Entonces, esa ha sido como la apuesta de las juventudes de poder brindar soberanía alimentaria a las personas pues que no la cuentan, ya que desde el gobierno nacional pues no se ha tenido esa respuesta. Por otro lado también, ya darle las recomendaciones. Frente a las recomendaciones es importante también resaltar no solamente, pues como lo mencionaba, de fortalecer las instituciones o de hacernos partícipes de las instituciones, sino también que esta cooperación internacional llega solamente a organizaciones pues consolidadas. Es importante dentro del estudio que se hicimos o dentro de las entrevistas que pudimos tener con otras organizaciones a nivel nacional, por ejemplo, nos comentaban que la cooperación llega a organizaciones. Entonces, como que se salta en ese filtro de poder pasar por el gobierno nacional, porque es claro que las organizaciones o que la cooperación internacional ya tiene presente que este recurso se queda ahí en los terceros. Entonces, lo que se ha hecho es una alianza específica con las organizaciones en los territorios para que ese recurso se pueda implementar de la mejor manera. Pues existe más confianza con las organizaciones de base, con las organizaciones civiles, que con el gobierno nacional. Dale. Bueno, y para finalizar, como les comentaba, nosotros hicimos 2 entrevistas a profundidad con la organización de San Agustín, que es PAOCOS, y con la organización ASOGE de Caldas. Estas 2 organizaciones trabajan en el sector rural y lo que han podido evidenciar precisamente es que las ayudas que llegan del gobierno o las estrategias que llegan del gobierno pues se quedan en el sector urbano y al sector rural pues no llega o lo que llega es muy mínimo. Entonces estas organizaciones se han dedicado a que la gente en el sector rural pueda tener lo mínimo para superar la pandemia. Claramente estas organizaciones pues son conformadas por jóvenes, entonces la importancia de la vitalidad de la juventud para poder hacerle frente y poder llegar a muchos de los territorios rurales en todo el territorio nacional.
Excelente. Gracias, Angie. Súper claro la presentación. Muchas gracias por el detalle y por traer la mirada un poco también de las organizaciones rurales al debate. En este momento, y siendo la 1 del mediodía, voy a pasar a hablar en inglés. Switching to English now. I'm really sorry for what happened. I'm not sure we could have avoided it somehow. And I hope that you can cope with us and stay for the 3 cases which are missing. I'm going to hand the floor now to Nisar, who's going to be presenting the case studies for Egypt. Nisar, you're there?
Yes, I'm here.
Yes.
Should I share my screen?
Please. Also, just one very small comment. With Meg, we are consulting if people know people that are trying to get into the room. So just check the chat because we will be asking there. Some people are requesting access. So we will be asking there if people know other people. So I'll stop my screen sharing and are you allowed to screen share? Or if not, I share it for you.
It should be fine. I'll share my screen, okay? Okay, can you see it?
Yes, perfect.
Is it full screen or not?
No, it's like I can see the program. I can see the.
Okay.
There it goes. Perfect.
So just a note before I start, I'm not from Egypt and I am not the author of this study. This was commissioned to an Egyptian journalist and researcher who unfortunately can't be with us today, which is why I'm presenting. And And it's going to be a brief presentation on the results of the study. It's a qualitative study. It did not involve a survey or questionnaires with organizations. It's mostly a qualitative study from secondhand sources and from updates. Okay, so beginning with a snapshot or a brief overview of the situation in Egypt, corona-wise. These are the numbers from October 9, as you can see. We have 104,000 cases, which is the 39 highest number worldwide, and the third highest in Africa. But in terms of cases relative to population size, Egypt performs much better. Performs better than 141 countries. So because Egypt has over 100 million people, which is why in terms of this ratio, it performs better. And in terms of death to population size, it also performs better, coming at 95 and 10th in Africa. So when I say 95, it's better than 94 other countries. When it comes to the government's response to the coronavirus pandemic, the measures were quite typical, like most other countries. Lockdowns, mostly partial lockdowns, including closure of commercial shops and restaurants, limiting the hours in which banks can operate, shutting down the airport for international flights for a few months. The schools, obviously, and the universities were closed, but will reopen soon. And all prayers in churches and mosques were banned for a few months and then resumed, but with this distancing and masks, etc. And since the summer, Egypt has been easing the lockdown measures, and I mean it's not in lockdown anymore. They're easing the restrictions and resuming economic activity in most sectors by now. In terms of the economic impact, obviously the closure of commercial sectors, especially services, had a big impact on economic activity. It's hard to assess it, accurately, because the year hasn't ended yet, and if there are official statistics, they haven't been out. So, but we know certain data that gives us an idea. In terms of one of the main challenges for Egypt is that it relies on remittances from Egyptian workers in other countries, especially in Gulf countries. And around 20% of those are expected to return, not simply because of coronavirus, but because the pandemic, along with the other reasons for the fall in oil prices, has caused an economic slowdown in Gulf countries. Therefore, what we have seen so far is that remittances have started to fall, and they're expected to fall by $7 billion, which is a big number in foreign currency. According to the IMF, this is the estimate for this year. And as I said, many workers, around 1 million workers, are expected to go back home and therefore lose the source of income and the remittances for the country. The growth is slightly better because Egypt is the only country other than Djibouti in Africa, which is expected to achieve growth this year, in terms of GDP growth, and we're talking about 3% as per IMF estimates. However, having to draw, to bring in new money from abroad because of the lost remittances and because of the economic impact, Egypt issued Eurobonds, which is basically the same as treasury bonds. So like shares in the state, if you want, or basically lending money to the state. So they issued Eurobonds internationally. And this means that people from from outside Egypt bought these bonds, lending money to the Egyptian government in dollar, which is harder to repay in the future, and which means that the foreign debt for Egypt is increasing and will be a burden in the future. For the economic impact on tourism, because tourism is a very important sector in Egypt, I focus a bit on it. I'm the author as well. Tourism employs 6% of Egypt's workforce, so it's quite big. And it was heavily damaged, obviously, like in all countries, by the lockdown, by the shutdown of the airport, the shutdown of beaches, which are a main touristic destination. And the revenues from tourism naturally fell quite significantly. They are expected to, for 2021, they're expected to be like a small fraction of what they used to be before, 2.7 billion compared to 17.8 billion dollars. So it's a huge impact when it comes to the tourism sector. And but you know, after I said that in summer the restrictions have been eased, and therefore tourists were allowed to enter Egypt again in July, and the sector is reviving, but you know, very slowly, because you know the tourism movement in the world is very slow now. However, it has the potential of recovering quickly because of the nature of the sector, especially if the vaccines become available for European and other tourists, and if you know the precautions are met locally. In terms of the social impact, I mean, Egypt has quite a vulnerable population, socioeconomically speaking, and poverty is around a third of the population is under the poverty line, and the income was already decreasing before the pandemic began. After the pandemic began, unemployment has gone up by 2%, which brought the number of unemployed people to 2.5 million people, and income decreased for over around 3/4 of the population since the start of the pandemic. And to understand this, why the income decreased, it's mainly because of informal work, which is very, very prominent in Egypt. Informal workers were the most affected in this crisis, like I believe in all countries, especially in the sectors where they are heavily employed, like construction and trade. And we have also a phenomenon of people stopping, like not becoming unemployed, but rather stop looking for work, which means that they are withdrawing from the labor force. And these are estimated to be 2.5 million people. Quite a big percentage of the population has withdrawn from labor force and is not involved in work anymore for the time being. Obviously, the impact on this impact on families, on poor families, was reflected in things like reducing expenditures on necessities like food, you know, replacing meat and things that are more expensive in food items with cheaper things like vegetables and rice, etc. All these measures people are doing to cope with the increasing poverty and lower income. And specifically, women were hit hardest, especially in terms of unemployment and work disruption. So in terms of unemployment, the new unemployment that was caused by the pandemic, the women were hit, received double the negative impact of men, meaning that the number of new unemployed people, percentage of women who are unemployed, is double the percentage of men who became unemployed in the pandemic. And the disruption of work affected more women than men. When we talk about youth, obviously there's a lot to talk about, but I'm mentioning a few points here. Unemployment among youth was already very high, and it's now estimated to be around 60%. It's an insanely high number, and you can imagine what kind of social crisis it causes. And youth are generally most of them work informally, around 3/4 of them work in informal sectors or without contracts. And as new entrants to the labor market, they have less benefits and fewer benefits and less job security. Around half of them work in services, and services were the most affected during the pandemic, obviously, by commercial shocks and etc. So this had a big impact on youth. When it comes to analyzing what has been happening, especially in terms of response and financing from the principal's perspective, in terms of ownership, foreign governments had a major role. I mean, the donations from foreign governments were limited given the size of Egypt and the needs, but they came from many sources: South Korea, China, India, UK, EU, etc. But the biggest support and almost a bailout came from the international financial institutions. The IMF had provided Egypt with 2 programs. One of them is a rapid loan, which they provided to most countries, and another one, which I forgot the details of, but together they amount to around $8 billion. The World Bank provided something like $500 million, and then European Bank for Reconstruction and Development also provided around 800 million. And the African Export-Import Bank provided $3.8 billion to the banking system in Egypt to allow trade to be resumed and revived despite the pandemic. Development agencies, this picture, for example, is one of the shipments that was received by Egypt from development agencies. There were a lot of, quite, as you expect, in big countries, you have quite a lot of shipments that arrive. USAID and UNDP and others have been providing medical equipment, mostly masks, ventilators, ICU beds, etc. In terms of Egyptian civil society, most of the action has been concerned with providing services to lower income groups, a lot of food distribution, and some personal initiatives or initiatives by doctors, etc., which focused on distributing masks, raising awareness, etc. And the private sector also had a role, not a major role in terms of large-scale programs, but also had a role in terms of the response. Okay, 1 second, sorry. There were some in terms of partnership, there was some initiatives that are joined between the state and private sector and civil society, but there was a big problem with the involvement of civil society in setting the agenda of the response and in monitoring. There wasn't a lot of transparency or accountability mechanisms. It's very hard for Egyptian civil society to monitor budget spending and allocations to know where the money is actually going, and there isn't a lot of transparency on the numbers and the resources that Egypt needs or lacks. And the lack of community dialogue and civil society involvement also leads to tensions between those and the state, and in one case between the doctors in private hospitals and the government, when the government imposed a rule on them without consulting with them. So it was one of the incidents. And finally, last word on focusing on results, leaving no one behind. There is the Egyptian government did make quite big steps in terms of financing and, as I said, receiving loans, etc., to stimulate the economy. But the social issues weren't as addressed. They didn't increase the budget, for example, the allocation of money that they give to, or food that they give to poor families, which is a big issue, obviously, because most poor families also work in the informal sector. And there was a heavy reliance on foreign sources when it comes to social spending, which raises questions around, effectiveness, reliability, sustainability, etc. So yeah, this is basically it, and hope that gave you a good idea.
Thank you, Nisar. Awesome. I'm going to give the word now to Karen. I think it's Karen from Lebanon Support.
Yes,
Are you
hi.
there?
Can you hear me?
Yes.
Okay, I'm going to share my screen.
Awesome.
Okay, sorry. Okay. Let's see if it's going to work. Can you see my screen?
Yes.
Okay, so let's start. So my name is Karen. I'm a researcher from Lebanon Support, which is a research center for and about civil society in Lebanon. So we're going to provide a screenshot today about the national response to COVID-19 in the context of Lebanon. So in our context, on top of a global pandemic, the country has also been witnessing a socioeconomic crisis and a financial meltdown. By financial meltdown, I mean the devaluation of the Lebanese pound And also now there is a crisis of liquidity. So at the same time, with the rising cases of COVID, which has now reached more than 52,000 cases, which is the 63rd highest in the world, there has been skyrocketing poverty and a rising in unemployment because of the bad economic situation. A lot of MSMEs have been closing down, so less opportunity to enter the job market. Now, in terms of the government's response, so when the newly formed government, there was a newly formed government on January 21st. So one of the first things on their agenda was to form a national committee to mitigate the spread of COVID-19. However, because Lebanon has limited capacities and material abilities to cope with the crisis, so there was a lot of aggressive measures at first in order to mitigate the spread as fast as possible. So the lockdown measures that were taken were very patchy and reactionary. So we started with closures of public and private institutions, airports shut down for months, nighttime curfews, and car plate number rotations based on even and odd numbers, and also obviously ban on gatherings to mitigate the herd spread of the coronavirus. Progressively, these measures were lightened, but however, throughout all the phases, they were not efficiently monitored by the government. Now, as we have mentioned before, the country was already going through an economic crisis. So the closure of these public and private institutions came at a very high cost, so much so that by January 2020, even prior to the spread of COVID-19 in Lebanon, about 200,000 jobs were lost. And again, GDP estimates for 2020 prior to COVID-19 already noted a fall of 10% with 25% increase in inflation. So the impact of the spread of COVID-19 further worsened the precariousness of livelihoods of everyone. No one was spared, no social class was spared. And indeed, as of late June, an additional 130,000 jobs were effectively lost. Moving on to the impact of on people. So the Ministry of Social Affairs estimated back in, I think, late March, beginning of April, that the poverty rate will be exceeding 50% by the end of the year, and that unemployment would rise by over 50%. So what this means for in the context of Lebanon, especially in the context of access to social protection, is that the system that we currently have, if you want to access social protection, it's not based on your residency or your citizenship. Basically, it's based on your link to the formal labor market. So with the massive losses of jobs, and the majority of population are left without any safety nets. And the National Social Security Fund that we have currently does not cover periods of job transition or even after retirement. So on top of a socioeconomic crisis, people are left without safety nets. So the government, to try to alleviate the situation back in April, they wanted to enact an economic support package. So the first thing was that they wanted to target 200,000 of poor households, so those most vulnerable. At the same time, increase the budget of the Ministry of Public Health by 10%, and then reschedule loans to SMEs at a low interest rate. However, and until now, it is not clear how this will be financed. So this presented a new chapter of fragility to everyone, and as well to vulnerable populations, including those displaced populations like Syrian refugees and Palestinian refugees as well. From the socioeconomic situation and the decrease in purchasing power due to the depreciation of the Lebanese pound against the dollar. So there was an issue with food security. And as the WFP study recently came up with this number, that 41% of Lebanese respondents stated not having stockpiled food due to their inability to afford the costs. Now moving on to the youth, I have some notes here. In terms of the impact of COVID-19 on the youth, the main challenges identified are linked to the switch from offline to online learning. And indeed, remote learning has amplified the gaps and challenges for the youth in gaining access to online materials, which ultimately sheds light on the fact that in the context of limited resources and technological capabilities, it is basically unsustainable in Lebanon to continue learning online. And the uncertainty of the current socioeconomic situation, further compounded by a health crisis, has also taken a toll on the mental health of the youth, who are facing an interrupted sense of normalcy and security, obviously, to varying degrees. And not to mention the pressure felt by university students with the decreasing number of opportunities in the job market, which is further worsened by the progressive closure of various MSMEs in the country. So this is just a note about the challenges that the youth are facing now. So in terms of national ownership of the localized response.
Karen, hi, I'm jumping in just to say that if we can please round up so that we have one more presentation and just for us to be able to finish.
Yeah, I'm gonna say one sentence from each subsection.
Okay.
So in terms of the ownership of the localized response, although the Ministry of Public Health mentioned in the National Health Strategy that they mentioned that they will be working with relevant authorities, government actors and non-government actors as well. However, the government has yet to create a formal platform for CSOs to discuss with governmental actors and produce recommendations and national policy development. In terms of inclusive partnership, we know for a fact that international donors and the Lebanese government are working with CSOs. However, based on my research, I did not come to a conclusion as to whether these consultations have been productive or simply cosmetic. And the government has not been very transparent about their partnerships and initiatives with CSOs. So I think we already discussed this a bit in terms of transparency and accountability, specifically about how to tracking donations, aid transfers, and information on mechanisms on how to hold donors accountable. This information is not readily available online or in public or in open source. And even if you want to get the information, the bureaucratic procedure is arduous and very time consuming. In terms of the results, the only way for the public to actually track the results are just to track the daily number of cases on the map that is produced by the Ministry of Public Health. And no more than that, because some of the reports are only internally shared between governmental actors and they are not made readily public. In terms of leaving no one behind, the Ministry of Social Affairs was attempted to target marginalized families with only 400,000 Lebanese pounds, which, if we take into consideration the black market rate of 8,000 per $1, actually amounts to $49, which is not enough. And as well, in terms of the refugees that are in the country, they have been facing additional discriminatory practices, further obstructing their access to basic services such as healthcare and freedom of movement. In terms of good practices, I'm going to talk about what my CSO is doing, which is because of the outbreak of COVID-19, it has amplified policies of austerity and shrinking public funds for social policies and reforms. So what has happened is that this has renewed the discussion around social justice and social protection in the region. So what we have been doing is that we have been organizing a series of webinars to actually rethink social justice, social protection, and social contracts in the region. I think in terms of recommendations, to wrap up a bit, and since this presentation will be available online afterwards, I think maybe we can just skip and let everyone read the recommendations when they have more time. What do you think?
Yes, definitely. So sorry this is being like this, but thank you very much. I'm taking notes on the main and common points, and I'm gonna give the floor now to Anton, just to share the last presentation of the day, because it would be good to be able to listen to the case study from Bulgaria and then just round up with some very short comments, because we are also pushing a little bit here on the interpreters. So, I mean, we're taking more time because of what happened, but we need to keep it to the point. So Anton, please go ahead, and I'm gonna ask you to be as concrete as possible. Thank you.
Sorry, I was not on mute. The implemented measures were timely and effective in limiting the spread of COVID COVID-19 in Bulgaria, although they had a negative effect on micro and small and medium-sized businesses. With regard to small and medium-sized businesses, no specific measures have been taken to support and limit the effect of restrictive measures. According to data from the National Statistical Institute, there has been a significant increase in unemployment growth 3 months after the beginning of the epidemic situation in Bulgaria. Our requirements of the World Health Organization for limiting the spread of COVID-19 in Bulgaria were met. I will not focus it on measures. Well, I will put our presentation on Google Disk. Everyone can see if you are interested. Impact on economics, mine sector, and effective activities affected. The tourist and entertainment industry was, of course, everywhere around the world have been cancelled. The flights, reservation, and etc. Culture and sports also. Public activities have been closed. Total trade, the most affected will be the trade in luxury goods, followed the trade in goods other than food. And we at first feel the consequences of that, of the pandemic and measures. Transport, of course, we have closed our borders and with our neighborhoods. Just we have green corridors in European Union. Real estate transaction, the market is abandoned or started constructions. Industry, extractive and processing industry, as a result of supply chain disruption and general contraction in demand. Credit institution, banking sector, there is also the main risks for the banking sector are related to the non-servicing loans in the most affected sectors. A decline in new mortgages should be expected, as well as in the servicing of old ones, and as a result of rising unemployment levels. Administrative activities also. Health and social services. The problem are related to ensuring the resilience and security of the system during the state of emergency. Yes, and it's a little statistic. Total incidence is 30 per 100,000 to people who are infected. Bulgaria is on 25th morbidity place in the European Union and 8th place of mortality. Job loss of income due to the COVID-19 crisis, the level of unemployment registered by the agency of the country in May jumped to 9%. In June, fell slightly to 8.3%, and in July 7.9%. According to the administrative statistic of the unemployment agency, unemployed people were 245,077 people, and decrease of 12,789 compared to July. There is some more statistic by gender. You can see the numbers. Also, we will not focus it on it, but we see that men lose more of the people who are lose their job are men. Increase the number of people, poor people, poverty rates. COVID-19 poses new major challenges of the Bulgarian healthcare system. Unemployment is expected to rise 7% in 2020 and then fall to 5.8% in 2021. The share of the people in risk in poverty and social exclusion was high even before the crisis. On the other hand, however, social transfer designed to reduce poverty are very limited. As European Commission once again recommends reform and a much stronger link between health and social services. More than 22% of the people of Bulgaria are on the line of poverty by the European Union criteria. Food security and hunger. There was no national strategy for combating hunger and reducing the impact of the epidemic measures on the most vulnerable social groups. More than 550,000 people across the country, or about 7% of the country's population, have stated the need for food supplies and the inability to feed themselves. The needs are mostly elderly people, young families, marginalized groups. About 19% of children and students still do not have access to fresh food and fresh every day. There is a program of Ministry of Education, healthy food for every child, but it's still not enough for everyone. Impact on women, how you know, everywhere. Yeah.
Sorry, I'm gonna jump in. Can we skip to the impact on youth and then just leave? We'll close it there.
Support for youth, employment, a bridge to jobs for the next generation European Union. However, the coronavirus pandemic has further highlighted the difficulties that young people often face entering the labor market. On 1st of July, the European Commission took action to give young people every opportunity to reach their full potential in order to shape the future of European Union and to thrive in the context of the green and digital transition. With next generation European Union and the future European budget, the Commission has already offered significant EU funding opportunities for the next generation and youth employment. So now European countries must prioritize this investment. At least 22 billion euro must be spent to support youth employment. Down you can see how is working this program, preview program of European Union. How I say, we'll share with you this information on our Google Disk. The Commission proposal for vocational education and trying to make the system more modern, attractive, flexible, and better adapted to the needs of the digital and green economy. You also down can see more statistical information about Bulgaria. Young women are practically vulnerable, as 36% of them working in sectors that are severely affected by quarantine measures. Restaurants, retail, tourism, art, leisure, compared to only 26% of young men. About 17% of young people reporting suffering from anxiety or depression, nearly twice as many as working people. Young people who lost their jobs or education during the COVID COVID-19 pandemic could be scared for the rest of their lives if governments do not provide immediate support, and International Labour Organization, ILO. Next slide will go. Impact on student youth. Due to the lack of electronic device in poor households, they failed to include their children in the changed environment and distance learning in the time. The Ministry of Education delayed to the delivery of computers and tablets for children in need by about 3 months. Nearly 35,000 students impacted of this. It's nearly 5% of the total students in Bulgaria. Ministry of Education pay Wi-Fi connection for the vulnerable and minority groups, those who are in need, but also delay with this measure for 1 month. There is something from United Nations. Also, you can check it. How I told you, impacts and displaced people and refugees. We have a lot of refugees in Bulgaria, and there have been, one of the measures have been to, how I told you, we close our borders and have so restrictive mechanism to stop refugee and migrants streams.
I'm jumping in just one more time because some people need to leave already. So unfortunately, this hacker thing made this webinar not so easy for some of us to work on this. Anton, we're gonna have to leave it here just because we are already 40 minutes over schedule. The intention was for us to open up the floor for a conversation, but there's no more time for that. I think that some of the main points that come up, which are many, are of course related to the job losses, to the impacts on the youth which are working in informal markets, and to the impact that this process is having in the education, not only in terms of access to education, but also the gap that's being created due to the lack of access to technology. And there's a very interesting aspect also in the process of empowerment of people, and also, what's that's on the screen? And also in terms of the amount of debt that's being generated in order to cope with the crisis now. So I'm gonna have to leave it here. I'm very thankful for everyone that was able to stick around. We will be sharing the PowerPoint presentations with everyone, and hopefully some new space can be created for us to actually debate on what's happening, which is clearly a very structural change in power dynamics in the world. I don't know if somebody else has any roundup comments to make. If not, we can leave the meeting. Somebody from the Global Secretariat.
Can I add something, Joe? Sorry.
Yes.
Do you see my screen?
Yeah.
At the end, I can tell you that all this house with the measures and that the government don't have a clear program or strategy to fight against the COVID-19. We have the protests. A lot of people are on the street, and how was in Germany and France, I think, and some other country is in European Union. And now this question are under dispute in European Parliament and Commission.
Thank you. Yeah, hopefully we will be able to provide a new and safer space for everyone to discuss. Evidently, social networks are no longer a safe space. Thank you everyone for coming. Thank you to the interpreters for their support and their patience. And thank you to Glenis and Meg and Daniela and everyone from the Global Secretariat that's providing support for this to happen. And to all the great studies and researches generated. So that would be it. Thank you for participating, and we'll stay in touch. Those that, I think we have everybody's email, but if we don't, you can reach out to me. I'll leave my email here in the chat.
Yeah, sure. So take care. And then everyone, thank you so much for participating. Global Secretariat for providing all the support and all the inputs. Thank you so much. All right, everyone. Good night.
Bye-bye.
Thank you, everyone. Good night.
Yeah.
Good night.
Take care.
Bye, thank you.
All right, thank you.
Thank you, everyone.